health check-in. We're digging deeper into why overworking is actually making us less productive, plus how to overcome FOMO, the fear of missing out. And as always, we just want to take this moment to pause, take a deep breath, and reflect on our emotional well-being. And to help us do that, let's bring in Dr. Erica Edwards. She's the chair of psychiatry at Sibley Memorial Hospital and assistant professor of psychiatry at Johns Hopkins Medicine. Dr. Richards, good morning to you. So many of us feel like we should be doing something all the time and that we're not doing enough if we don't feel overwhelmed. I know I feel that way a lot. So it turns out overworking, well, it actually makes us not as productive. Why is that the case? What more can you tell us about that?
So this is part of a series focused on work-life balance with that key question, exactly. Do you feel like you're not doing enough unless you're overwhelmed? So anyone that has a to-do list knows that as it grows, it gets harder to get started on even item number one on that list. So in the workplace, this manifests as productivity paralysis. When this occurs, it's really hard to get things done. And what happens is your workday becomes longer. You go into the weekends to get things done. You skip lunch breaks. You work later. But what we know is that a rested worker is a better worker. So in the UK, there's a movement called the 4-Day Week campaign, where they're fighting for decreased duration of the work week with about a 32-hour max without any changes in pay to try to increase productivity within that time frame.
4-day work week, that would be absolutely amazing. All right, Dr. Richards, let's turn to social media, which many people are on 7 days a week. There's that feeling of missing out when we see other people posting pictures and they're having fun. So how do we overcome that fear of missing out, or as it's known, how do we overcome FOMO?
FOMO, always a good discussion. So at the heart of this topic is comparing ourselves and our experiences to others. And for a second, let's talk about what's good about doing that. You know, we learn from examples from others. It's how we adapt, it's how we go, it's how we grow, it's how we move forward, not only as an individual, but as a society. But FOMO, that missing out, that fear of missing out on happiness, things that may increase our happiness, is really what that discussion comes to be. And what we know is that there's really three concepts to remember to prevent this. Number one, there's an article that talks about practicing abundance mindset, essentially telling yourself that just because someone else has blessings, just because someone else is having fun, it doesn't mean that there will be less available opportunities for you. Number two, minimize your time on social media, especially when you're trying to decompress and take time for yourself, because that can be a trigger. And number three, really remember that when you're worried about missing out on what's happening over there, you're really missing out on what's happening right here with you. So mindfulness is very important to practice.
That is all great advice. I'm going to remember all of that. Thank you for that. All right, let's talk about the impact that mental health conditions can have on others. So if you support a loved one who struggles with a mental health condition, whether it's anxiety, depression, bipolar disorder, anything that can make day-to-day life a little tougher, you might feel selfish to prioritize your own well-being. Help us understand why it is important to protect your own mental health while trying to help others too.
This is a great article published in Essence magazine, and it really highlights the importance of setting boundaries and taking care of yourself. Let's talk numbers just for a second. Nearly 1 in 5 adults are living with a mental health diagnosis. So a lot of people out there are really supporting loved ones that are struggling with mental health illness. What should you remember? There's a great metaphor in the article that talks about if you see a loved one drowning, don't take off your life jacket and give it to them. What we know is that you're most helpful for others when you're healthy, when you're happy, and when you're rested. So taking that time for you is important. And the three things they want you to do really is find a community. And I'll highlight that one only. Find a community. You need really at least 2 different communities. One community that understands what you're going through, that is sharing a similar struggle of caring for a loved one with a mental illness. But you need a separate community that really has nothing to do with that allows you to take off that care provider hat and really spend time focusing on yourself and rejuvenating.
Lots of important advice about taking better care of ourselves. Dr. Richards, thanks so much for joining us this morning. We really do appreciate it.
Thanks for having me.
We've got some promising news this